It has almost been 2 years since the start of the COVID-19 pandemic. Although there are now numerous forms of vaccines, cases of infection, hospitalization, and death have fluctuated in multiple waves. Many pharmaceutical and biomedical companies have been formulating their own vaccines since the beginning of 2020, some showing more positive results than others. However, it can be difficult to choose which vaccine is right for you. Luckily, I'm here to help.
Hi there, my name is Gwendolyn Grimmick. I'm a student at Johnson Community College, and this is my honors experience project. My mentor was Dr. Lisa Drawn. This research project is important to me, as it directly affects my family and my work in healthcare. The purpose of this project is to provide accurate information about the effectiveness of vaccine therapy on COVID-19. This project will discuss the multiple types of immunizations, their effectiveness statistics, as well as their side effects.
I will now take you throughout the process of my honors project. Each step is called a deliverable. My first deliverable consisted of me meeting with my mentor, Dr. Lisa Drawn. Dr. Drawn is a biology instructor at Johnson Community College and has been a wonderful mentor to me. Her background in biology helped me expand my knowledge about COVID-19. We met every other week throughout the semester. During this meeting, Dr. Drawn helped me determine my 2 goals: research vaccines and create a pamphlet. I decided to present my findings through a pamphlet so that my audience will have the opportunity to physically have the information that they need and decide exactly what they want to focus on. Before our first meeting, I researched how many pharmaceutical companies are producing COVID-19 vaccines. I found 21. However, throughout the duration of my honors project, I decided to discuss 6. The 6 companies that I continued to conduct research on are GlaxoSmithKline, Johnson & Johnson, Moderna, Novavax, Oxford AstraZeneca, and Pfizer. Now it was time for my second deliverable, which marked the start of my extensive research. During this section of my project, I began reaching out to my 6 companies via email for any information that they could provide me with on their COVID-19 vaccine. Johnson & Johnson sent me 3 PDFs, Moderna referred me to their case hotline, Novavax sent me 1 PDF, and Pfizer referred me to their prescription hotline. Along with this, I began researching some companies. I first started with Pfizer. Pfizer has created the BNT162b2 vaccine. Clinical trials show that 2 doses pose a 95% efficacy rate in people 16 years or older. During the reported clinical trial, 9 cases were reported among vaccine recipients, compared to 171 cases in their placebo recipients. The next company I researched was Moderna. Their vaccine is named mRNA-1273. Per their clinical trial, 1 dose is 80.2% effective and 2 doses are 94.1%. During their clinical trial, 11 cases were seen in vaccine recipients and 185 in placebo. Since I received some responses, it was time to move on to my third deliverable. Johnson & Johnson sent me a PDF discussing the emergency use authorization granted for their vaccine as of January 6th. While an EUA was granted, the vaccine has not been fully approved or licensed by the FDA. The PDF explains that a single dose of this vaccine can result in 6 months of immunity. The second PDF from Johnson & Johnson is a healthcare provider fact sheet. Released January 31st, the PDF explains that this vaccine is a single 0.5 milliliter dose with a 0.5 milliliter booster administered 2 months later. Contraindications or concerns for this vaccine include acute or severe allergic reactions, thrombosis with thrombocytopenia, Guillain-Barré syndrome, acute immunocompetence, and syncope or fainting. The final PDF that I received from J&J was a letter from the FDA addressed to Ms. Rita Walla-Walker on October 20th, 2021. The letter communicated an EUA approval for both the vaccine and the booster. The FDA also reviewed the clinical trial. The trial had 43,783 participants, resulting in 2 efficacy rates, a baseline efficacy of 66.9%, and an efficacy regarding moderate to severe COVID-19 of 66.1%. I also received a PDF from Novavax, which discusses the results from their clinical trials. The Phase 3 trial in the United Kingdom presents an efficacy of 96.4% against the original strain and 86.3% against the alpha variant, resulting in an overall efficacy of 89.7. The Phase 2b trial conducted in South Africa resulted in a 48.6% efficacy. There were 147 cases reported due to the beta variant, which was spreading at the time. Their PREVENT-19 pivotal Phase 3 trial demonstrated a 90% efficacy rate and a 100% rate of protection. It was time to wrap up the research part of my honors project. With a partnership between the University of Oxford and AstraZeneca, a vaccine was created called CHAdOX1-nCoV-19 or AZD1222. During the trials, an overall efficacy of 70.4% was reported. 23 cases of COVID-19 were reported in vaccine recipients and 19 in the placebo recipients. 39 of these cases were linked to the beta variant, and multiple health complications arose, resulting in an endpoint efficacy of 10.4%. Tens of thousands of adverse effects were reported, including transverse myelitis, thrombosis at atypical sites combined with thrombocytopenia, and vaccine-induced prothrombic immune thrombocytopenia. The clinical trials have been paused while all participants recover. GlaxoSmithKline has developed multiple partnerships, resulting in a vaccine and a booster involving an adjuvant. Based on their Phase 3 trials, there are 3 efficacy rates reported: 57.9% against symptomatic COVID-19, 79% against moderate to severe COVID-19, and 100% against severe disease and hospitalization. Now that I had completed all of my research, it was time to format my APA citations. I was a little rusty on my formatting and knew that I needed some help, so I sent my document to Dr. Lisa Dron. She helped me tremendously and left comments on how to fix the formatting and also found some dead links. So, what exactly are dead links? Dead links are websites that have been removed from a database, and I was unable to use these resources. However, I found some similar sources and was able to replace them. One thing that I needed help with specifically was how to APA cite the PDFs that were sent to me. Dr. Dron referred me to Professor Elizabeth Baker. She provided me with the correct way to APA cite a PDF, and I was able to fix the other 3 I had. She was a great help. With that, my citations were complete. I used 37 sources, sorted them by company, and numbered them so that I could reference them on my pamphlet. Speaking of my pamphlet, it is now time for my last deliverable. My pamphlet is titled Your Guide to COVID-19 and Vaccine Therapy Efficacy. It gives a brief overview of COVID-19 and vaccines, discusses companies and their efficacy rate, sorting them based on whether or not they were granted an EUA, side effects that can be experienced, and a QR code is provided to access my resources.
By participating in the JCC Honors Experience this semester, I have further expanded my previous knowledge of COVID-19. Hopefully my pamphlet was useful in providing vaccine efficacy information and was an accessible way for you to keep yourself and others safe.